Alright, we have a lot to talk about on this one, so without further ado, let's get started. Remember, on the last video I said if you could please go to joeyjohnsondo.com and donate $3 under the donation tab. I also said that we would come back to all of this, so now's the time to. I explained it on the last video, of course, on how we broke this down, so now let's go through it. So, toga virus, okay? We're coming over here. These are the RNA enveloped icosahedrals. We come over here for toga virus, and there's the treasure trove doll with rubella, because the rubavirus is what is going to cause rubella, okay? And you should definitely know by now, of course, that that's part of the MMR vaccine that you get, measles, mumps, rubella, alright? And so the thing about rubella is it also known as the 3-day measles. Remember, we did it in the comparison chart, and it is transplacental. Alright, it is one of your torch viruses or starch viruses that we talked about in the other video, and it's airborne via respiratory droplets. You have the Forkheimer spots with this, which are the spots and petechial stuff on the soft palate. You have a fever first, then it descends. The fever goes away, and you have a rash from the face down, a descending rash, okay, from head down. You also have auricular and suboccipital lymphadenitis and tenderness, and so auricular just means around your ear there, okay. You're going to have kind of little post-auricular and pre-auricular lymphadenitis, swelling of the lymph nodes there, alright. Kids don't seem ill with this. There's usually a low-grade fever, but it's not like roseola, okay? Roseola is where you got the little kid sitting back, just reclined, chilling, running around, playing ball, and he's got a freaking fever so high it can give him a seizure, literally, okay? So it's not like that, but the kids aren't very ill. There is a low-grade fever associated with it, and unlike other toga viruses, it is not an arbor virus. Remember me discussing arbor viruses, okay? We and E are arbor viruses, so that means they are arthropod borne, and we will discuss more later about how they're arthropod borne, but for right now just know that the tick will bite the reservoir of these, and then it will bite either the human or a horse, and so it actually stands for Western equine encephalitis or Eastern equine encephalitis. Of course, equine means horses, so it can infect humans and horses. Flavivirus, alright, dengue fine, alright, so with dengue fever, it's in the tropical areas, it gives acute inflammation, it is spread by the Aedes mosquito, and again, don't worry about that, I'm just mentioning those now. We will have a whole vectors portion here in a little bit. Actually, the next lecture will be a vectors portion. It releases pyrogens and pain mediators in the body, and if you get it a second time, you get breakbone fever from a type 3 hypersensitivity cross-reaction, okay? And hemorrhage and shock will ensue, so this is hemorrhagic fever at that point. Yellow fever, also acquired in tropical areas. It's by the same vector, that Aedes mosquito, Aedes, and you get necrosis and hepatitis and jaundice. So now let's go on down to the sleaziness right here. Sleaziness of Flavor Flav, okay? St. Louis encephalitis, also Japanese encephalitis, damages your neurons. West Nile instead of West Side, okay? You get IgM against it in the CSF. It maintains itself in a bird mosquito cycle, and it's going to be the Culex mosquito, C-U-L-E-X mosquito. We'll talk, again, we'll get into that next time. That's going to spread it. It's incidentally spread by the mosquito to humans after biting a bird, and it replicates in the skin Langerhans cell, then migrates to the lymph nodes, and it causes CNS and multiple organ issues from the resulting viremia, and once again, that is West Nile virus. So now let's talk about HCV right here, this juice he's sipping on. Alright, you get that from IV drug abusers, transfusions, sex, blood. It causes acute form, which is jaundice and fever. It also has a chronic form, which is cirrhosis and carcinoma, because remember, it is not one of your viral hepatitis we talked about last time. You have a higher rate of chronic carrier states on HCV than you do HBV. And the other thing is, you can remember the treatment for this as ABC, okay, because you have interferon A is going to treat Hep B virus and Hep C virus, okay. When you talk about interferon beta, that's going to treat multiple sclerosis, alright. So interferon A is going to treat Hep B and Hep C. So now, let's continue on. Let's go to the Delta virus up here next, alright. must have had a previous HPV infection to get HTV. HTV cannot infect alone. It is one of your circular viruses. Remember, you're talking about your circular viruses. Omas, B bad, okay? The B is for HBV there. And then bad is for Bunyaviridae, alright? And then you're going to have arenavirus, and then you're going to have HDV, and your two omas are going to be papilloma and polyoma, which are in that Papaviridae region, okay? And that's why also they're in the cojones, of the boy, DNA baby. So anyway, HDV here, remember you're going to treat it. Let's see, you can treat it with alpha interferon as well. So I said, remember ABC, you can go ahead and say ABCD. So alpha interferon you can treat with you can treat Hep B, Hep C, or Hep D with alpha interferon. Okay, recombinant HBV antigen, you're going to give that to prevent getting HBV. Therefore, you prevent indirectly getting HDV. People that have both HBV and HDV have a poorer prognosis. And HDV, it's the only human virus that can, let's see, well, it comes in like a ribozyme, R-I-B-O-Z-Y-M-E, and that means it's an RNA particle that can cleave and ligate its own self, and so it's the only human virus that can do that. I don't know that you'll be tested on that, but just know that. Alright, so now Htlv, these are your retroviruses, which means they work by reverse transcriptase, okay? Htlv, alright, that's going to, you're going to see it as flower cells in the blood. Looks like flowers, okay? Causes adult T-cell lymphocytic leukemia. Also HTLV1, associated myelopathy. And it's endemic in areas like the Caribbean, Southeast USA, and Japan. Alright, and it's transmitted just like HIV, including through the breast milk. It's going to attack the T cells, affects your CD4 just like HIV. This one turns on your IL-2s though, and so the IL-2 receptor genes are then going to stimulate T cell growth, and it has a T cell target. Then you can say that it has a T cell target, it has an extremely long incubation period as well. And so the way it happens, it replicates, is it binds to your CD4s, enters your cell via fusion, then reverse transcribes its genome into your chromosomal DNA. That's going to integrate the genome into your host chromosome, and then it starts replicating on and targeting the T cells. So now, HIV. For the boards, you want to know HIV, okay? So let's go ahead and spend a little bit of time on HIV. And I apologize for my voice. If you guys can't tell by now, I have a little something going on, a little scratchy throat here or something, okay? So you're going to diagnose HIV with the ELISA test. That's the gold standard for diagnosing. Then you're going to confirm it with the Western blot, okay? Western blot test. You can also use the RT-PCR to check the viral load. To check the viral load there. And also, it's going to check the success of the treatment you're using in the course of the disease. So basically what you'll be checking is the P24 nucleoplasmid protein of the GAG gene. P24 of the GAG gene. Alright? And that's going to clinically monitor the viral load there. You have three basic retrovirus genes, and those three basic genes are going to be ENVI, GAG, and POL. You'll also want to know that there is a TAT gene as well. And so the saying I say is, I do not envy TAT GAG POL. I don't envy TAT GAG POL. Okay? And so HIV-1 is more common than HIV-2. Just wanted to say that HIV-2 is mostly in West Africa. But the three genes right here for ENVI, okay, it's going to be associated with your GP41. That's going to mediate cell fusion. Also, you're going to have your GP120. Alright, that binds to the CD4 receptors and makes it mutate. And GP just means the glycoprotein in the lipid envelope, okay? So the glycoprotein of these lipid envelopes, you got the 41, which is going to do cell fusion, okay? And then you got the GP120, which is going to bind to the actual CD4 receptor and make it mutate. Now, the GAG gene, alright, remember me saying that's going to have of the gag gene, you have the P24. All right, that's sitting on the gag gene, okay, and that's what you're going to look at, that serological marker there, to kind of check and see the progression of treatment, also to see the course of the disease. And then the pol gene is going to do reverse transcriptase and also integrase and protease. That's what it's responsible for. TAT is going to do regulatory, it's the regulatory portion of the genome, we could say, and it also suppresses synthesis of MHC class 1. And if you remember, MHC 1 is going to be associated with cytotoxic T cell 8s, okay, because the rule of 8. So you have class 1, 1 times 8 equals 8, and then MHC 2 times T4 equals 8, because 4 times 2 equals 8. So that's your rule of 8s when you're dealing with immunology, okay? Primary infections via sex for HIV, of course, blood or maternally. CD4s are infected. It replicates in the spleen and lymphoid tissue, and its clinical latency is about 7 to 10 years, okay? The virus mutates during that time so that it can evade, with an E, immune defenses, and you get AIDS when your CD4 levels drop below 200 in the cells, okay? So let's begin talking about what you can get with the various CD4 levels now. Okay, so right here are the different CD4 levels for HIV, okay? So let's kind of walk through these. Do I remember all of these? No, not by heart, but I'll show you kind of how I remember it, okay? So if your CD4 drops below 500, I think there is 5, right, for 500. Candidiasis is 5 syllables, okay? And so when we drop below 50, there's 5, right, in the CD4, and so mycoavium is what I think, and so that is going to be below 50, okay? And so those are your two extremes. If you see a CD4 below 50 on a test, it is a good bet that you can get mycoavium, is what they're trying to get at. And so MAC is what you'll see it abbreviated as, has secondary tuberculosis characteristics when they're describing it in a vignette, from typically from what I've seen anyway. And so just remember, mycoavium is 5 syllables, candidiasis is 5 syllables. Okay, and so that'll get you those right there. And so then when we come here to the 100, I just say C, 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 the 3 C's. Okay, CAT, because that causes toxoplasmosis. It's going to be Rieden's lesions in the brain and meningitis. We'll talk about that later, of course. CMV and Cryptococcus or Cryptosporidium. Okay, so I just think your C's right there. Okay, so you got your cryptors, you got CMV, and you've got CAT stuff. All right. Cryptococcus neoformans causes the meningitis. Cryptosporidium parvum is the watery diarrhea and GI stuff. So anything else, just kind of familiarize yourself with these. His and coccidioides, those are kind of your regional specific mycos, okay? And so then you have your Molluscum Contagiosum, Giarvecchi, and you have your PML, the one over that with the JC virus, all right? So that pretty much covers your CD counts there, all right, for HIV when your CD counts drop below. And remember, whenever your CD counts drop below 200, that's actually when you're diagnosed with full-blown AIDS. Now, we talked about Cryptococcus neoformans right there on the, when we was talking about AIDS. And so I want to go over this. Remember, this is when your CD count drops below 100, okay? And so if you look at this right here, I've kind of outlined here what to expect. This is the agent that's causing the meningitis. This is our meningitis chart. This is the opening pressure changes, white blood cell count, glucose use, protein present in microbiology, okay? So Cryptococcus neoformans is going to cause increased opening pressure, just as bacteria would, okay? Both of those are going to cause increased opening pressure, whereas if you notice in contrast, viruses will cause a normal opening pressure, so will aseptic meningitis, okay? You're going to have a normal opening pressure with those. Cryptococcus and bacteria will cause an increased opening pressure. When we talk white blood cell count, pretty much everything that's going to cause meningitis is going to cause a white blood cell count. The biggest difference is, as you see, bacteria will cause it above 300, and so that's the big thing about it. And viruses is typically going to cause it to be below 300, but bacteria will cause it to be above 300, but all of them will have an increased white blood cell count, indicating something is wrong. For glucose, bacteria uses sugar, so you're going to have reduced glucose so low it's going to be below 40 actually, okay? You see the normal range here is 50 to 75, and so with Cryptococcus you'll have decreased, but not that low, okay? With viruses it'll be normal, they don't use the sugar. Protein, you're going to have increased protein with just about all of them. You see some normals in there, and then that's how we're going to figure out the the microbiology, if you remember Indian ink, is what's going to really let you know and tip you off on that cryptococcal neoformans. That is it for this one. Thanks, guys. We'll go over vectors on the next lecture.